Afternoon.
Welcome to day 16 of social distancing and our first shelter-in-place webcast, Obesity and the COVID virus.
Yeah. Hello to all our patients and family and friends, and we hope you're all doing well. And we're looking forward to doing more of these once, and hopefully more smoothly, technically.
Absolutely. We're going to work out the kinks. We're in the middle of a global crisis of unprecedented proportion, never seen in any of our lifetimes. And with all the changes and limitations ongoing, this puts us in a unique position. Cabin fever and all that goes with it to struggle potentially with our weight.
Yeah. And besides the difficulties of managing your weight when you're at home and stressed, is that COVID-19 seems to have a high risk of infecting people and people doing poorly when they have obesity. So it's really important that we are getting ahead of this disease as quickly and aggressively as we possibly can with whatever tools we possibly can right now. And because, I think we're all coming to accept that this disease is going to be around for a while. And we need to get everyone as healthy as they possibly can so they can do well.
That's great. That's great. You can always check us out on our website, vivamd.com as well. We'll flash that up for you in a little bit here too. At Aviva, we take care of people struggling with the disease of obesity, finding solutions to provide longer, more healthy lives. So, Dr. V, what does this COVID-19 mean for someone with obesity, and what could we do about it?
Yeah, well, let's talk about it. There. Also, if you have any questions of the people online, please feel free to type them in and send them to us, and we will try to find them and answer them as well as we can. There'll be a question and answer session at the end. We'll kind of go through a couple topics we've prepared now. Fantastic. So, Dr. L, you want to lead us off with kind of the overarching story of COVID-19 so far?
You bet. You bet. A lot of people are familiar with this map out of Johns Hopkins. And truly it is a pandemic. It's worldwide. Came out of China, as everybody knows, out of Wuhan. Nearly 1.5 million cases now, with about 93,000 deaths globally. In the United States, we have over 360,000 cases in the United States now. New York still being the worst hit state. Interestingly, in our state currently, we're at about 9,300 cases, almost to 9,300 cases. And as of last check, just over 432 deaths.
Yep. The exciting thing is that in Washington State, we're tentatively excited that our local hospitals and healthcare systems have done an exemplary job, and state officials of getting ahead of this, and we seem to be flattening the curve and hopefully being on the other side of it. And our healthcare system is not overwhelmed, and the Army hospital that they set up in CenturyLink Field is actually being disassembled and sent to other states. So we have a lot of things that we're thankful for, and we're really thankful to all the people that have been on the front lines and the leadership that's been in place here.
Exactly. And speaking of which, we were talking about Aviva and the measures that we've taken to protect our patients and protect our staff, and a special shout out, of course, to our excellent staff in coordinating all this, in particular our clinical nursing director, Gaya Lukovic, who early on saw the danger of this and set up protocols to make sure everyone was okay.
Yeah, and special thanks to Chris for making all this possible. Number one on the YouTube, but also Chris has done a fantastic job of, he was way ahead of the curve in getting all of our staff working from home as soon as, actually even much before the actual stay-at-home order came out, because we wanted to just make sure that everyone stayed as safe as possible.
Yeah, and really, really smoothly as well. So we're actually able to see patients via telemedicine all around the region, and the staff, we all huddle in the mornings as well to talk about clinical issues and things going on with the practice. So thank you, Christol, for taking care of us. All right, so some basic information about the COVID-19, this new and aggressive coronavirus.
Yeah, so how does this COVID-19 infect people?
Yeah, a lot of good information out there, how people are being exposed and put at risk. Where the infection actually comes in has to have a portal of entry, whether it's through the nose, mouth, or even actually the eyes. It affects first usually the upper respiratory system, can affect the GI system as well. But where the real risk is and the real danger is, and I know, Dr. V, you're probably going to want to talk a little bit more about this later on, but the lower respiratory tract. It comes from droplets in the atmosphere or in our air, where someone can cough or sneeze unprotected. Certainly can be on surfaces as well, smooth surfaces. It can live for some time. And there's also a concept of something called aerolization, where actually just by breathing and talking, it's possible. We don't know the science on this yet, but there may be some transmission risk. We also talk about the inoculum science behind this, and how if people have large viral loads that they're exposed to, it's entirely possible that people will do less well given what they're initially exposed to with regard to a viral load. But irrespective of that, it's best to avoid exposure whenever possible.
Yeah.
So what are the statistics when people do get infected, Dr. V?
So this is these are kind of big picture statistics. It looks to be about 80% of patients have mild infections, 15% of them have serious infections, and 5% are critically ill. The death rates of that really vary a lot between the countries that we're seeing, and also some of the critical care rates and intubation, and particularly long, ventilation statistics vary wildly between countries and even geographically. We see a very big geographic difference between, here in Seattle versus, Louisiana's getting hit really hard, and New York, of course, is getting hit really hard right now. And the numbers just look very different, and there's a lot of factors that kind of play into that. The one thing that is certainly concerning, and I think those numbers will also get diluted as we understand and we get more testing. We'll see that, there's probably a little bit less of those. But I think that doesn't underplay this virus at all, because I think what's been the most scary about this virus is that you have young, healthy, working people get really sick, and some of them are dying. And what we've seen, and the more and more evidence is mounting, that the people the biggest risk in that under 70 category, people that are not doing well, are people that have comorbid conditions and that are obese, that are overweight. People that are, have diabetes, have hypertension and obesity, that are young, are still getting really sick from this disease, and those are the people that are still potentially dying. So that's just not something we've really seen on such a scale ever in the modern world. And so I think that's been a really big part of the scariness of this disease.
Absolutely.
And it's also the reason that we're talking about this today is because obesity is really central to people doing better. Getting their obesity and their comorbid conditions healthier is really critical from a big picture public health standpoint of helping people do better from this disease.
Yeah, absolutely right. And I think the underlying causes for that, Dr. V, is we know that obesity affects people's immune system. That's very well spelled out with regard to the comorbid medical conditions you talked about, but things such as increased risk of cancer and so forth, which directly seems to be related to the immune system. So certainly, we've talked about in the past inflammatory states. We'll probably talk a little bit more about that as well. But that interesting study that we found, in fact, we can kind of flash this up for everybody, is an article that came out. Was it in the French literature or was it in the Dutch literature?
There's both. There's both French and Dutch literature. There's also stuff from the UK that's showing that patients, like their ICUs that are filled, the people in the ICUs, 70 to 80% of them that are in the ICUs are obese people. And we're seeing very similar relates to that, in this country as well. Louisiana is getting hit really hard. There's a lot of factors that play into Louisiana, but a very big one of them is obesity. Obesity is a huge issue in that state in general, but also it's a huge factor of the people that are 97% of the people that have died in Louisiana are people that have other obesity related comorbidities. So it's a really big factor.
I think a couple other things that we talked about too is it seems like obese males may be particularly at risk. And I also saw an article recently, people of color as well. African Americans can be at increased risk of doing poorly, and I know the Latino community also has been hit hard by this as well.
Yeah, there's one of the senators from Louisiana is actually a doctor as well, and I was reading one of his articles and one of his interviews, and he was talking about, and we know this too, that there's a little bit higher expression rates of the ACE2 protein in particularly African Americans and Africans, and which can put you at a little bit higher risk for getting this disease, because that seems to be sort of the gateway protein that this virus seems to like to activate, is through the ACE2 protein. It's its favorable entry point into cells.
Yep.
And actually that protein is upregulated when you have obesity, when you have hypertension, when you have diabetes, that you just make yourself so much more available from a cellular level, like a cellular protein level on the cell membranes of your cells, to getting the disease and having it spread through your body.
Absolutely. So what can we do now, Dr. V? What sort of preventive measures can we consider kind of acutely?
So number one is getting healthier. And so obesity is a very difficult disease. We know that. We take care of this disease every day, and it is one of the most difficult diseases that we take care of. So what we're really encouraging patients is to, get involved, start talking to someone about helping you, getting some nutritional counseling. If there's some medical weight loss stuff that needs to happen, like maybe trying some medication. We don't usually push medication as one of the first lines. Usually, talking about all the behavioral things that go with, with eating, with exercise, with, support, with dealing with your stress, with dealing with your, bad things that have happened with you in your past, dealing with your support structure that surrounds you. And then, we also address the biologic factors that kind of play into obesity, which is, it's hard to do anything about your genetics. That's kind of just the hand that you're dealt. But, there's some other factors of maybe some of the medications you're on make you more prone to obesity. So we kind of see what things that we can be doing there. But also, and this is where surgery plays in. And surgery seems to dramatically change people's physiology and their anatomy that's set up for obesity. And so that's kind of a part of our the discussion we're having now. We're not able to do any surgery right now because of this virus. But we're looking at all of those things as a comprehensive thing. And the other thing we're really stressing, so we're trying to get really connected with the nutritionist, get connected with medical weight loss, start talking about, now if you ever thought about surgery, because you're like, man, I should do something about my health with my obesity. There's no better time to start thinking about that now, because this virus is not going away. And the best scientifically proven treatment for obesity is surgery. And then the other things is I tell people do what they can do right now while they're at their homes is, find something to start exercising with. Okay. That's a huge, huge part of that. If you think about it like when you step back and you think, okay, when I was doing some dance videos or something like that, some exercise videos online, and I was like really out of breath, and it was really hard, and that really sucked. And that's actually what it's kind of like to be critically ill, is that it is a major physiologic stress on your body. And the more that you are exercising and tuning your body up, and the more times you have of that, like, this really kind of sucks. My body really is tired and it doesn't like to do this. That is actually what it's like to be critically ill. It is very stressful for your body to be critically ill. It puts your body through a lot of stress. And the more your body is tuned up, the more your body is really, if you ever do get this virus, if you do get really sick, your body can handle it way better, and you can have your chance of recovery is so much better.
That's really true. What do you think
about? The other thing I'm actually telling people too is, and there's literally zero data behind this. I caveat,
Sure.
that there's no. I actually encourage people to do deep breathing. So when you're doing fully expanding your lungs, like the for 3, 4, 5 liters that you're using your entire lung volume, you open up. Your lung is full of all these tiny little air sacs, and the air sacs on the periphery are the ones that don't really open very well. When you're just taking normal, small, the small, normal day breaths. It's not until you take a full deep breath that you actually really open up those air sacs in the periphery. Mm-hmm. And opening those up, this is actually where, when they do x-rays of people with COVID-19, you see that on the periphery of their lungs, that is where the infection seems to start. And that's where it really seems to take hold. You see people that are completely asymptomatic that have horrible looking x-rays. Most of the peripheral portions of their lungs are where this disease can look like it starts. And that's the part of the lungs that's not fully expanding. Those sacs are kind of consolidated. There's not much blood flow. Your immune systems your lymph tracts. They aren't moving the fluids in and out, and they're not getting bad stuff away like they should. They're not bringing in good immune cells and good nutrients like they should be. So taking deep breaths actually expands all that tissue on the periphery as well, and gets healthier, fluid and nutrients and immune cells to those places, and gets all the waste out too.
It's interesting too, when people are struggling with their weight too, just the mechanics of breathing can be difficult, especially when you have central obesity. You can't really get the diaphragm to drop. But having said that, there really is no downside. So wherever you are, with regard to your weight health, trying to keep your lungs open and clear is good. And conditioning as well, getting used to taking deep breaths and even strengthening, I think there's no downside.
Absolutely. Like there's nothing, there's no downside to that. There's no science that says that, deep breathing keeps people from getting coronavirus or better. There's zero scientific studies about that, but it does not hurt. And it makes people feel better just in general to really continue to re-engage the full totality of your lungs. So,
yeah. What do you think about masks?
I think that there is absolutely no downside to masks. The masks people are making at home, the masks, they're just like the kind of simple, surgical masks you see people wear, just in general when it's like flu season at times. It certainly doesn't hurt. Okay. It certainly doesn't hurt. Okay. It can hurt. I mean, there's no guarantees. There's no 100% medicine because sometimes they can work against you in very specific circumstances. But for the vast majority of situations, I am a big, I totally believe that people should, masking is a great thing. The N95 masks are the ones that kind of get a better seal, and they're the ones that filter out 95% of the particulates. Those ones, a little bit, the ones that are hard to find now, and certainly those do a better job, and those are really the gold standard. But they can be hard to find, and what you have is certainly going to not hurt.
Yep. So. Let me ask you a personal question. When you go to the grocery store, do you wear a mask?
It depends. Sometimes I haven't really been to the grocery store. My wife does all the cooking, actually, or has been to the grocery store the whole time because she goes while I'm working here at home. So
okay, all right.
When I've gone out though, if I'm going to be in a closed, the nice thing about grocery stores, they're kind of generally larger spaces.
Good point.
Certainly, you're going to be in a closed, confined area. There's really good data, especially coming out of Asia. That has a lot of dense population. The flu is very common there. That masks do a really good job, and that's why they wear them frequently.
Got it. So you alluded to surgery, of course, being the best way to treat someone with the disease of obesity and accomplishing, what we're trying to accomplish here, which is being in a better, healthy state to be able to fight something like this if the unfortunate occurrence happens that you're exposed to it and get it. In the current shutdown with elective surgery being kind of sidelined, what's your thought? When do you think we might be doing surgery again? I know that's a tough question.
Yeah, it is a really tough question. I'll be curious to see what your kind of thoughts are too. But we're all in this together, and we're going to listen to our state officials and really go by best practice guidelines. And at the same time, the way that we're going to fight this disease is by getting people healthier. Yeah. And surgery is by far and away scientifically proven the best treatment for obesity. So the sooner we can get back to surgery and get people in a better state, because this virus isn't going away. I think we've all accepted that. It's going to be here to some extent. The Governor Cuomo was talking about today. He said, this thing's going to come in waves, just like everyone, all the major epidemiologists are saying, look at the 1918 Spanish flu. It came in multiple waves. And I think we should probably just accept that this is probably the first wave. And we want to prepare as many people to be in a better place for wave number 2 than they are if we're for wave number 1 right now. Yeah. And so we're going to try to get as soon as we can. We want to get as many people down the road to getting better as reasonably and as safely and as clinically appropriate as that is. So that's kind of my take. I mean, yeah. I'm curious to hear.
You're absolutely right. I mean, it's a risk benefit kind of ratio, and we're going to talk a little bit more about what surgery, acute phase after surgery and risk of that, of course. But there is this concept talking about this wave of epidemic. There's good literature out there like on diseases like the measles, for example, and a community is actually safe when you have a herd immunity of people about 93 to 97% being either vaccinated or have had the disease and recovered from it. And I would predict that we're going to probably see that kind of occurrence with waves until we kind of hit that mark. And I guess that brings in the next question. When do you foresee a vaccine being available?
Oh, I don't know. The experts are kind of, the thing is I hear is kind of, this is just what we're saying is 12 to 18 months, but there's a lot of stuff, there's a lot of diseases out there we don't have vaccines to. So, true. Putting all our eggs in that basket is, I don't think it's necessarily, I don't think it's that wise to assume that we're going to be able to get a vaccine to this disease because we don't have a vaccine to everything, So I think that's a good next good question from a surgery standpoint.
Sure.
Is what do you think? If when you have surgery,
right,
what does that affect on your immune system, and as well as fighting COVID-19
right.
in the immediate sense, in the long-term sense? Like, what are the numbers you generally think of and kind of tell patients?
Well, it's interesting when you're following, we follow thousands of patients going through this process, right, Brandon? So what we see people, especially the first week after surgery, that there is a very common fatigue factor where people just don't have much stamina, because the energy that would get them through a normal day is, of course, going toward healing and sealing on the inside. But I'd say as we break into the second and the third week, people really start turning that corner. But I would anticipate, at least empirically, there's no real good proof on this, but for that first couple of weeks, we really want to minimize people's potential exposure to this virus even more. But I think after, once we're out 2, 3, 4 weeks, I think the benefits to the immune system as people are actually getting healthier and nutritionally being bolstered, I think they're going to be in a better place to actually resist and be able to fight this better immunologically.
Yeah.
What are your thoughts?
Yeah, I'm totally, agree with that. I generally tell people in the first 1 to 2 weeks, your immune system is mostly focused on trying to heal from surgery. Mm-hmm. And, it's going to be taxed if you're also finding an infection. And that's what we see when people are fighting postoperative infections, is that, that's just an extra stress on your immune system, and it doesn't have, it's not 100% to fight that. So there's that short-term window of where you're like, yeah, you are a little bit more at risk. And so making sure people are healthy and safe and don't have coronavirus before they get here and just have surgery and then they start getting sick is certainly something we're going to really pay attention to and take every precaution, not to put them at risk, and tell them to lay low, and that's what people generally do after surgery, and also is just lay low. So
you bet.
But I mean, I think after that sort of like 1.5 to 2 week window, mm-hmm. You see people. It's really cool to see people how they kind of respond to that. I've seen people in that 2 to 3 weeks mm-hmm. that they kind of come over that hump, and then they're like on that chronic inflammatory state that you see with obesity kind of starts reversing, and you see an anti-inflammatory state. So like patients that have major arthritis issues, and some of that's a big component of that's inflammation. Mm-hmm. And not chronically, like without even putting weight on it. And they tell me at 2 to 3 weeks, they're like, wow, I just kind of turned a corner, and like all of a sudden my knees and my joints didn't hurt all the time. And that was before they'd really lost much significant weight. Like they'd only lost a few more pounds, 10, 15 pounds, and they'd lost that before, and they hadn't experienced that sort of, systemic change in their feeling of like their joints. The people that have rheumatoid diseases, like got some lupus patients, and at 3 months, they're like, man, my lupus symptoms largely have just gone away. Like I haven't really struggled with that at all. And there's a lot, and I certainly don't promise that to every patient that's going to be their experience. And sleeves do seem to be different than bypasses with autoimmune diseases. Yep. But, from an inflammatory state, there definitely seems to be a way better situation and a way better health of your immune system and a way better balance of your immune system, even in a short in that short after 2 weeks duration after surgery.
And I think kind of what you're alluding here to Dr. V, is after people have gone through this process of surgical weight loss, their immunological status is vastly improved, right? And so their ability to fight things like coronavirus and other problems.
Better balance of your immune system, even in a short.
Yep. So I can see Chris working in the IT background here. Can you still hear me there, Dr. V?
Yeah, I did. I had to turn off. There's a woodpecker banging on my fireplace.
It's that time of year. Those are the flickers. They love to sit up on top of the bee vent.
I know.
And hammer their
head
against it.
He's trying to find a mate, and he really thinks that my fireplace is the best conduit for that.
Well, at least it's not 6 in the morning.
So I'm not getting hailed with machine gun fire. So that's a plus. It's just a woodpecker.
All right, fantastic.
So I just tried to mute it because he's just going crazy back here. So I don't know if you can hear that, but
I could. It sounded like there was a machine gun in the background there.
Yeah. Yep. Right. There he goes.
We're in a war zone. So I think we wanted to open this up to some outside questions, and I think Chris is trying to work in the background so we can actually see those. So we'll give him a moment to see if he can catch up. Any other issues you want to bring up in the middle of this?
Yeah, I think just talking about, and I think kind of dovetailing on the recovery from surgery from an immune system standpoint is from a comorbidity standpoint.
Yeah.
That your diabetes and usually hypertension and sleep apnea, some of the biggest risk factors with this disease, do make a big difference rapidly after surgery. So even in that 3-month window, even if the weight loss is actually, like, I think a second player, is a supporting actor to the benefit of the rapid improvements in insulin levels and its blood sugars. They're just different, and they are better and much better.
That's a really good point.
And you're going to be our patients that have surgery, they're going to be in a better place in 3 months, where they would have been otherwise.
Absolutely. And specifically, even with it's amazing what happens, particularly in type 2 diabetes, where we've seen patients the day of surgery whose insulin. Good.
Yep.
All right. Let's see. Are there any questions out there?
Yeah. No, I think this is a crazy time going forward, but I think it's an exciting time to really consider, really getting after your obesity and your diabetes and those things, because there's honestly never been a better time to take that seriously, because that is such a risk factor with this virus. And this virus, I think all the experts agree and have accepted that it is not just going to disappear. It's going to be around.
Okay, Brandon, I got a question for you. This one came in, says, thanks us for taking the time. We're happy to do it. This is what we enjoy. So a question: when you're talking about exercise and deep breathing, would you say to stress cardio over strength training? So would you stress cardio or would you stress strength training?
I would stress cardio for sure. Yeah.
Okay.
I think absolutely both are beneficial. Both have certainly help your body feel better, but if you're going to be 60-40, one versus the other, the cardio part is by far and away better for you and will better help you manage, if your body is critically ill, or, it's general overall health in general. Yeah.
Okay. Got another question here.
What are your thoughts, Dr. L?
What's that, bud?
What are your thoughts on strength versus cardio?
Well, I appreciate that. With regard to cardio and getting your heart rate up and so forth is great. But I'll tell you what's interesting. Whenever I do strength training, it seems like it turns into some cardio too. You know what I'm saying? Nothing like getting your heart rate up by doing some reps. So
it's true. Yeah, you do doing some good solid, putting in a number of reps, you'll be feeling it good.
And here again with our surgical weight loss patients, doing a little bit of resistance training, of course, also increases lean body mass, which helps your metabolism. So there's an upside there as well. So
it's like this, I think it's like a supporting actor for sure.
Okay.
That is indispensable.
Okay. Here you go. Another follow-up question. We've kind of alluded to this already, but we'll put it out there again for you, Dr. V. So if you've already had surgical weight loss, are you at a more compromised health-wise to get COVID-19?
I would say not necessarily because you've had surgery. There's nothing about the surgery that, especially if you're remote from it, like more than 2-3 months, definitely more than 2-3 months, that puts you at a higher risk for having, for being immunocompromised. Definitely nothing like that. If you still have obesity, because surgical weight loss isn't a cure for diabetes, it's a tool. And there's a lot of people that still struggle with their weight. They still have some component of diabetes, still have some component of hypertension.
Sure.
Those things those aren't just, magically go away after you have surgery. So when you still have those risk factors, then you absolutely still have risk factors for doing worse for COVID-19 than if you didn't have those risk factors.
Right.
But it's for most patients, that all those things mostly get better. Almost all of them, for everyone, they get better.
Yeah.
And so you're probably in a better state you're probably in a better situation now than you were if you hadn't had surgery.
Absolutely. Thinking about the hundreds of patients, thousands of patients we've had a chance to take care of who are in a better health state, I think it's not necessarily going to change whether they actually get it if exposed, but I think their clinical course will be vastly improved.
Mm-hmm.
They'll do better with it. Well, that's great. That's great. Well, I tell you what, we've really enjoyed the time today. Thanks for spending a little time there, Dr. V.
Yeah. Do we have more questions?
I don't see any others coming across here. I don't know if Chris is going to feed us a few more or not, but it's been helpful and informative.
Absolutely.
All right. So to all of our viewers out there, friends, family, patients, be safe, be well, stay in touch.
Absolutely.
You know,
Yep.
check us
And
out
come
on
on. Certainly check us out
avivamd.com.
on avivamd.com.
Right.
Did you just say that?
I did. I echoed you. You pretty much say it and I just kind of repeat it, We call it a professional life, you and I.
Was there more questions? Sorry, I think I actually do have one more question.
Oh,
Some
you
more
do?
questions.
Okay.
Yeah. Yep. Can you touch more on chronic inflammatory? My knees don't hurt any lower. Surgery was 310. I'm down 33 pounds. Yeah. So. Yep. Yeah. So let's. There were some questions about more of the chronic inflammatory state.
Yeah.
And yeah. So I kind of like we alluded to before. What seems to happen after surgery? Well, I think with obesity in general, obesity, particularly being at either a stable high weight or especially a growing weight, it's a very chronic inflammatory state. Like that caloric positivity is continually pushing your chronic inflammation high. As you go into a negative caloric state, that seems to have some sort of anti-inflammatory properties. I think we don't really understand the mechanisms of that scientifically yet, but I think something just as a bariatric surgeon I've observed a lot is that even just going on a negative caloric diet has a lot of positive chronic inflammatory benefits to it. Like your joints aren't hurting as much. People's autoimmune diseases seem to be getting better. And also, I think there's some component is also the diet. So the diet that you're kind of forced to be on after surgery is by far and away like a pretty anti-inflammatory diet. Like a lot of the things that especially in that first month, you're pretty limited on some of the things you can eat. And most of those things tend to be on the anti-inflammatory, spectrum of dietary foods. We're getting to understand more and more how certain foods, seem to really aggravate inflammation, and some foods, seem to actually really benefit, the anti-inflammatory state. So, I think there's so many factors that work together on that chronic inflammation state that it's multifactorial. And I think the benefits after surgery, number one, that you're just absolutely you're limited by the food that you can eat just based on your anatomy. Really keeps you accountable to some of those anti-inflammatory states and to that negative caloric direction.
Yeah.
Which, all of those are anti-inflammatory.
Yeah. And just adding to that too, it's interesting. We talk about, losing weight through the surgical process. But what we want to emphasize is healthy weight loss, in that people are mobilizing and losing the excess fat, which by its nature is fatty acid, which, some people have described obesity as living in a fatty acid metabolic stew. By its nature, that's an inflammatory state. So if we can have people mobilize and burn off that excess fat while maintaining their lean body mass, that just by its nature is going to help correct that underlying inflammatory state. So,
yeah,
good.